Whether it's binge eating or healing from trauma, it can feel like an uphill battle. And you can feel like you've tried so many things but aren't making much progress. What if there's a way to get to the root of what was leading to many of these things that we struggle with day in and day out? And that is why I'm so honored to have Dr. Laurel Mellin on the podcast today. Dr. Mellin is a health psychologist, New York Times Bestselling author, and the founder of Emotional Brain Training, a neuroscientific self-therapy that is changing healthcare. She developed EBT during her 40 years as a professor of medicine at the University of California, San Francisco. Dr. Mellin is the executive director of Solution Foundation, which conducts EBT research and trains health professionals and coaches to deliver EBT in their practices and online. I am so honored to have Dr. Mellin on today. She shared so much incredible wisdom in understanding ourselves better, understanding the wiring of our brains, and how we can approach healthcare differently. I hope you enjoy this episode as much as I enjoyed the conversation with Dr. Mellin. All right, welcome back to another episode of Rewiring Health. I am so honored to be joined by Dr. Laurel Mellin. So thank you so much for being here today.
My pleasure, Kelly. Thanks for inviting me.
Yes, absolutely. I can't wait to have this conversation. I know this is going to be something that is so beneficial to people, and we're just chatting for a little bit. And this is something that I think cannot be said enough, especially in today's world. But before we get into everything that you do, can you just tell me a little bit about your backstory and what brought you to what you do today and the people that you help today?
Oh my gosh, a long story, but I will say that I started with my own problems, which were binge eating and depression. And I couldn't really get a solution to that. I ended up becoming a nutritionist, and I got a great job at the University of California, San Francisco School of Medicine, where they had a grant, but they didn't really know what to do with me. So I got to do what I wanted to do, which is I tried to find the root cause of obesity, because I had this drive to overeat. And what I did is I found a solution, and this was many years ago, about more than 25, that it turned out that if you process emotions in a certain way, people would stop overeating. And it happened first with children, and then I moved to adults. And then I moved to realizing that that same thing was for eating, drinking, spending, depression, anxiety, relationship problems. It was kind of a cure-all. And I named the program The Solution. I was on Oprah 3 times. More than 500,000 people have used it. But it wasn't until about 10 years ago that we discovered why it was working. And, I'm a scientist, and you know that if you're in science, you must know the mechanism. You don't just give people a pill and say, oh, it worked. You need to know what is the mechanism. And what was missing is we didn't know why people were losing weight and keeping it off. Why were people changing for the good, not just for the short term? What was changing in their brain? And what we discovered was the tools we'd been using all along, and now we've sharpened them, actually rewires the amygdala. The amygdala is the center of all of our circuits that control our physiology, our emotions, thoughts, and behaviors, and ultimately health. And so we had somehow come upon this where we could develop a program where people come in, and the key is you can't change the amygdala with thoughts, because it is the circuits are emotional. They need emotional processing. And we have an app and a program and support groups. You have to be in a support group because the emotional brain is a social brain. And unless you're with other people, the brain gets scared or bored. And when you're with other people, it is fun. So you have your support group by telephone, 5 other people plus an EBT provider. You've got the app that works it, and you got a program, and you essentially start rewiring circuits. You learn how to turn stress into joy, because the circuits that causes problems activate stress. So you've got to dismantle it and flip that circuit to a better circuit and come out the other side with joy. And you need to do it quickly. On the app, you have a choice between 1, 2, and 3 minutes. Literally. But that took from 2007 to 2000, almost 25, to get it so fine-tuned that it can perform in that way. So literally, it's a disruptor of current healthcare, because currently you go to a therapist, they're trying to get at the same circuits, but they're talking their way through it. It takes 10 years. You learn how to use the emotional techniques to go right into that circuit, find out what that circuit in your unconscious mind is telling you, and change the message to change the circuit. Also, pharmaceuticals, because when you change the circuits, you change from the circuits that are called allostatic circuit, which is a nice way of saying bad ones that have harmful chemicals, to homeostatic circuits or good ones that make you healthy. So we're changing our health by changing the circuits that cause the chemicals. So you're changing the chemicals so you have a pharmacy in your own brain when you use EBT. So between that and the fact that doctors are stuck, they're trying to help people with their chronic disease, and they're telling them to eat vegetables, get good sleep, exercise. No one, when one of these stress circuits is going because they're biochemically affected, is going to do any of that. If someone tells you to stop eating bad, you're going to either overeat or undereat, but you can't find center because your brain is affected by the stress chemicals. So instead, we say, don't change anything. Just essentially start using EBT, spiral up out of the stress, notice everything's easier, take about 4 circuits that you know of that you don't want, you, with your support group, rewire them in just a couple of weeks each, and all of a sudden your habits are going to change. You're going to be sleeping. You're going to be wanting to exercise. And the health problems you have, even the wonderful things you're doing for them, are going to go that much better because you've changed your biochemistry.
Amazing. I love it. And like just as you're speaking, it's like our bodies always have the propensity towards healing. Our bodies are always on the path of healing. It's just that we have all these things that end up blocking the natural processes of returning to homeostasis. So I love that you talk about the emotions. I think Dr. Joe Dispenza talks about the emotions are the language of the body. And it's like if we're not tapping into that, we're missing a huge aspect of healing the body, especially when we talk about health. And I would love to hear so if someone is struggling with maybe, negative emotions or maybe the overeating or like overworking, perfectionism, anything that they're kind of addicted to, what does the process look like? So if they enroll in EBT, what is the starting process? And I know you mentioned the community and everything. Can you kind of walk through
Sure.
that process and what that looks like?
Right. What happens is you join, you have a membership. It's inexpensive compared to therapy. And you have your own provider in a group on a telephone with 5 other group mates that are also raising their set point and getting healthy. And you meet just for half an hour because nobody has time anymore. But in that half an hour by telephone, you get to know the other people. And also, you set out so you can help each other during the week. What I mean by that is on the telephone, it's completely private and confidential. You can push a button, and if someone's available, they'll answer. And they listen to you, use the emotional tools for 5 minutes. And what that does is it greatly expands the effectiveness of the tool. And both people go from stress to joy in about 5 minutes. So it makes their day. And these community connections, the research at the University of Kentucky has showed that the EBT, these little connections during the week with people in your group, the same 5 people, are what make the difference in weight loss and mood and health and how much people like EBT. So you have your group, half an hour a week, and then you just touch base with them and you get to know these people over time. And then every single day of the year, there's something called a spiral up session by telephone. Again, you call in. If you're having a bad day, there's actually an EBT provider right there every day, and they'll either help you use the tools so you clear that stress, or you just sit in the room and listen to them help someone else. And the emotional brain has no walls. So when you listen to, let's say I was at work and just had a fight with my boss. I come in, I'm feeling really disgruntled. I sit in the room, and essentially in about half an hour, it's just a half an hour session, I'm in joy. I don't even remember what I was thinking about. So it's daily emotional support, forum boards, and a program. So you start with the program really easy with just learning how to do the app and realize that how to use it so that when you're stressed, you turn that into joy. And I mean, it happens in 1 minute or 2 minutes then. Okay. So then you've done that and you're feeling really good. And people say, wow, why doesn't everyone know about this? And then they go into the next step. That's the first step, is resiliency. The second is you rewire four circuits of your choosing. So let's say you have a mood circuit where you get stuck in a mood, or a relationship circuit, or a work circuit, or an addiction, let's say a drinking circuit or whatever. The circuits are all rewired the same way, but you use the same tools, but this time you do it more focused. You actually find that wire, and then you essentially treat that wire over and over again like this until boom, it goes away. It's easy to know that you have results. Let's say that you're overeating. You never try to change your food. You find the circuit that's causing the chemicals to drive you to overeat, and you rewire the circuit. And then you notice, oh my gosh, I'm not doing that anymore. So this is completely new to people, particularly people who have been dieting. They say, you're supposed to watch what you eat. I said, no, you're supposed to watch the circuits that are driving you chemically to eat. If you watch them and change them, you won't be overeating anymore. So they rewire four circuits. The body circuit's a big one because people judge their body, but everybody's just choosing whatever circuit they want that matters to them. And every time you rewire a circuit, the habit of the brain goes toward joy instead of stress.
Mhm.
And the number one health problem we have is the set point of the brain. If you're in stress, you have a low set point, you're going to have multiple problems. And even if you cure that problem with a medication, you'll get another one. Because when you're in stress, stuck in stress like that, the brain starts manufacturing mental health problems and physical health problems and such. So the program takes, 8 months to a year. Some people take longer. And you actually raise the set point of your brain so that you have no problems, you just have challenges. And that's best for mental health and physical health and longevity. So the aging that comes with stress is really a problem. So it turns around that tendency to have premature aging as well.
It's fascinating. And I love that how it gets that root cause, especially in the example of overeating and people are saying, oh, just eat this or have a better diet. It's like then that propels that cycle of shame even more so, you feel like you know what you should do, but then you don't do it. And then you feel shameful for it. And then I would imagine you just stay in that low emotional state because you're doing something again that you're feeling that shame around. So it's like, again, staying in the cycle. But what I love is like you're interrupting that and then now changing the way that everything is wired in that way.
And you know what's so important, Kelly, to me is right now, a lot of people are taking GLP-1, those weight loss drugs. And
Mhm.
I would never tell someone not to take a drug because I think if I want to take a drug, I'm going to take a drug. But I want to tell you what is so sad and even sick about it. So what's really a problem is that people now are taking this GLP-1 drug, which is very expensive, and also it doesn't really do the trick, and they become dependent on it because it's not going to the root cause of the problem. The root cause of the problem that's making 70% of us overeat and overweight is that our brain is set up for stress because of our hunter-gatherer ancestors who were starving, that when we're stressed for any reason, like even a psychological reason, it activates 8 chemicals that make us overeat and gain weight. So if we don't deal with our stress, we're going to be overeating. If we deal with our weight by giving one of these chemicals, which is what the injection does, not all 8 of them, we're going to become dependent upon those medications. We're going to have side effects, and they do take away your joy because they make people a little feel bad, most people feel a little bad inside. But here we have a problem with obesity where people shame themselves. Finally, the drug companies come up with something, but it doesn't solve the problem. It just creates more dependency. So the way you solve the problem is EBT. EBT is the only method other than weight loss surgery that's ever shown in peer-reviewed literature to produce lasting weight loss, which it has in 2 studies at 13 months, 2 years, and 6 years just from using EBT because you erase the circuit that's causing the chemicals.
Mhm.
These 8 chemicals are cortisol, dopamine, insulin, ghrelin, uh, PYY, serotonin, leptin. And what happens with these chemicals is that they create such a mix that you not only are hungry, but you're hungry for just the foods that make you fat And then what happens is once you eat them, then you feel bad about it, then you feel more depressed. So it's a chemical mix of 8 chemicals, not the one GLP-1 only. And so that's what you do. If you come into EBT for 1 year, it's $89 a month for full service every day of the year professional support, and you will have rewired your brain for lasting weight loss without drugs. And that's called freedom.
On the Be the Good with Kate podcast, we talk to individuals from all walks of life and industries who have found ways to follow their passion and do good along the way. Be it a nonprofit founder, kindergarten teacher, Broadway music director, hospital clown, or the 120 other guests we have highlighted on the show already, these stories inspire me deeply, and I hope they do the same for you. With actionable insights, advice, ideas, each guest shares his or her journey from where they started to where they are now and what they would tell someone looking to make a positive impact through their work as well. We each have the power to make a difference. Find Be the Good with Kate on all podcast platforms and YouTube.
I love that. And it's like just going off of what you're talking about with like the GLP-1, I was just watching a documentary. They were talking about people are losing the weight, but they haven't rewired the circuits for self-worth and self-love. And they are still feeling nothing's changed internally. So they've lost the weight, but there's not a change internally of how they're feeling about themselves. And now I didn't realize something I didn't realize, and maybe some people listening now, is that this is something that you're taking long term too. I always thought it was something you take for a few months and then you lose the weight and you get off of it. I didn't realize it was a long term thing. So I think that's also something.
Right. There's 2 parts of that. Number one is if you take GLP-1, you will no longer be hungry. Many people. However, there's something in the body, as you know, is homeostasis and adaptation. So what happens is that after a while it wears out. Okay. And if you really have diabetes and you actually need it, it'll wear out. It'll take longer to wear out, but it will wear out. But something more, not only do you not rewire your food circuit, so you still have a food circuit that's sitting there. It's just that it's been sort of a band-aid of the chemicals that normally come from that food circuit are being overpowered by an injection, an artificial. And so you still have the circuit, and that's why when you stop the injections, you will start overeating again. Why not just go to the root cause? I mean, there's so much shame around eating. This is a time that people who are struggling with binge eating and overeating and weight can be proud of themselves. I am going to rewire the circuits in my brain that cause this problem. So I am not going to take drugs the rest of my life. I'm not going to be on a diet ever again. I'm going to eat healthy naturally because I have done the work of changing my brain for lasting weight loss. I want that freedom.
I love that. And it's like so empowering to realize that you don't need something outside yourself. It's all within yourself. And I think just having that shift where I think as a society, we're always grasping at straws, trying to find the next quick fix, but to realize we always have the power within ourselves. It's like the Wizard of Oz, Dorothy's trying to figure out how to get home. She had her shoes with her all along. She could have gotten herself home. It's like, here we all have this power to bring ourselves home to a place of homeostasis and joy and the life that we desire, but we just have to get to that and use that as a root cause. So
The other part of that is people come in, let's say that one of your listeners says, I don't care about food that much, but my relationship is a problem. So anything that's really important is very sensitive to stress. So sex, relationships, spirituality, food, these are all very, very sensitive to stress. So they come in and they say, I've got a relationship problem. Say, great, come to EBT, learn how to spiral up through your negative feelings to your positive feelings, and then a couple of weeks later, you're going to be in your support group. You have 5 other people you're working with, like a team, all raising their set point together. You start rewiring, and you're going to rewire your relationship circuit first, because that's what bothers you. So this woman came in and she says, my relationship, I don't know, I can't stand my husband. He's such a dud and he doesn't ever listen to me. And, like this, and you say, well, if you rewired your relationship circuit, I wonder what would happen to your relationship. And what happens to the relationship is even if one person in the relationship uses EBT, the relationship will change. Because for it to go bad, both people have to be locked in a pattern that's very unhappy and not working. One person starts using EBT to get the circuits in their brain of love and limits going, and the other person says, this is a new person. this is actually a person I kind of like, but they come in and they do the relationship. And as soon as they're done with their first circuit and they say, I love this, they say, I'm going to do my anxiety circuit. And they do their anxiety, and then maybe they do their drinking circuit. So what happens is it's fun. And even though these are the same circuits that are addressed by therapists, you go to a therapist, and how many months and months and months do you go without getting results? And also, the truth is, we're not back in the dark ages. It is fine to have a therapist. I'm not against therapists. But the fact is, the technology that makes you able to rewire a circuit that a therapist is trying to rewire is in your hand. All you need is the procedure that's in the app and a small, loving group to have fun doing it. That combination, you compare that to what happens with a therapist. You can go to a therapist for 3 years, or you can go to EBT you'll see changes in the first 2 to 3 months that are life-changing, and then it gets better and better after that. So we need to modernize mental health care. It's in the dark ages. They don't even talk about circuits. All these emotional problems that people have, they've got all these diagnoses for them, but actually they're all circuits, ineffective circuits. There's only one way to rewire them that people can use. And once you've learned to rewire a circuit, you, in a sense, are your own therapist. The only difference is you need inspiration, you need the love of a group. And that's why when you come in, we don't allow anyone to have EBT app unless they are in a group, because it won't work. It's the combination of the fun of the group, the fact that people are changing before your eyes and that you're inspired by each other, and just that it's about joy, not pathology. Your joy back.
Yeah, and I love the idea of the group too, because it's like once you raise your consciousness and your level of energy, that I know there's more and more research coming out with that too. It's like everyone raises up. So when you have 5 people who are all have a similar intention of raising themselves up and healing, I imagine that also plays a huge role in why they all do better because of being in that group. So yeah, I love the concept and that you do incorporate the groups, because I think that's something that's also very much missing in our society now, is a sense of community, in that we all feel like we're on an island kind of just doing your own thing. So it's like bringing that sense of community back, especially with people who have a similar intention and goal. So
Exactly. And one of the reasons that the groups can be done in a half an hour is, many people go to 12-step, and that's a really wonderful way for people to get free support and be with other people, because it's isolation that is so hard on us. But the fact of the matter, whether you're going to a psychotherapy support group or a 12-step resource, people talk on and on about their problems. And remember, problems are just circuits. If I have a circuit in my brain that I have to do everything perfectly, and I'm sitting here ragging about the fact that my life isn't going well because it's not perfect, I can rag about it for hours and bore everyone to death, and also infect them with my negativity. EBT process in the brain, and this is a natural process, is there's 23 steps on the resiliency pathways. You have to ask yourself 23 questions that are complete sentences. So you need an app because it's complicated enough and it has to be done well enough that you can't just wing it. But if you've got that app, and which we do in these what we call community connections, where you're on the phone, you say, is this a good time for a connection? Yes or no? The person says yes. We've got 5 minutes. Who wants to spiral up? And the other person listens. What happens in that room is in 5 minutes, people go from being depressed, complaining, miserable, to being joyful and of purpose, because they've used the brain's natural pathways. So we're not hanging around complaining. What we're doing is listening to each other get to joy, and when someone else gets to joy, it's contagious, and that's doable. That's practical. And EBT is the new neuroscientific psychotherapy that empowers people to help themselves, and not always have to go to a therapist or always have to get some diagnosis, because they're all circuits.
Yeah, it's so amazing. I like, just going off that, I just had a question for you as far as like emotions. So if we're feeling maybe grief or fear or whatever we're feeling, how important is it that we experience those emotions, or is it about going to joy as quickly as we can? What's the difference between those, allowing ourselves to feel that in that
very important.
versus joy?
Okay. Number one, EBT is not happiness training. If you try to be happy all the time, if you try to be happy, 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 which is, skin deep, it is terrible for your brain because we have two kinds of circuits. We have the circuits that are resilient and reactive. If you pretend that you only have resilient circuits, these homeostatic circuits, and you keep a smile on your face, it means all the circuits, and everyone has these circuits that are ineffective, these allostatic circuits, these reactive circuits, they get stronger and stronger and stronger. So the point of EBT is you want to be stressed every day, because if you're stressed, and let's say you get triggered or you're just feeling really bad, it means that the circuits that are problematic are unlocked. They are ready, they're unlocked, and they're available for rewiring. And so you essentially actually go after having problems and say, I can't stand it that my teacher did this to me and this to me and this to me. This is part of EBT. So you get yourself upset. You unlock the circuit that's making you amplify how bad it is, and you spiral up, and it's all in about 3 minutes. Okay, so it means that you identify your stress level. There's 5 levels of stress in the brain, and you from no stress, basically, up at brain state 1, where the neocortex is in charge. And then as you go down the side of your face, the limbic brain is in charge. That's about 3, brain state 3, feeling a little stressed. And brain state 5 is stressed out. So the first thing you have is your number. You say, I'm at brain state 4. I'm going to use the tool for brain state 4. And what that tool does is it has you complain, because you've got to get it out. You've got to say what's bothering you. And then you use 4 feelings: angry, sad, afraid, guilty, quickly. And it demolishes the stuck depression or anxiety that you feel. It helps you understand what the circuit is that's causing it, so you can change the circuit. So you want to be able to be in all stress levels, but when you're triggered, you want to not stay stuck there. You want to use EBT to essentially rewire that circuit and have you come back up to feeling great within a few minutes.
Yeah, I love that. And just having that freedom to be able to feel what you're feeling and encouraging that to release it, but then not staying there long. So I love that.
Exactly.
For someone who maybe has experienced some kind of trauma in their life, maybe they've gone to therapy for years, they feel like they are still very much in the thick of it and dealing with it. Can you talk about, someone who's experienced that and then using EBT and how maybe that's changed them and changed their ability to
Right. So what happens with trauma is it stops our development. It's just like a big old boulder that goes in our brain. And so what it does is it gives some survival circuits that are those triggered circuit. It gives some core circuits, which means negative beliefs. And it also has some fear memories. And it's all locked in just a bundle of these circuits. This is horrible for our health because we get even a little stress, and that block, or that boulder of these circuits go boom, and all of a sudden we're in a stress overload. So it takes away our self-confidence and also our sense of well-being. And then what we do when we're in that state is also not very healthy. So EBT is really about trauma treatment, except not going to your therapist, but learning how to do it yourself in a direct physiologic, not psychological approach. So, for instance, when I was about 11, I had a lot of trauma going on, and I was teased at school, and I had all sorts of other problems. I was depressed, and I was overeating, and I had made this glom together trauma circuit that had to do with overeating, depression, powerlessness, hating my body. And so that circuit from those very, very difficult experiences was like in the bottom of my brain. And like anyone with these circuits, I did the same thing, which is you start by talking about it and telling the story of it. But every time you tell the story, if you go to a therapeutic situation, psychotherapy, you've got to talk for the moment you start to tell this, well, this girl was bothering me and she was making fun of me at the same time that I got rejected at the school. The moment I feel stressed, then I process my emotions with EBT. And then I tell the story a little bit more. As soon as I get stressed, I process the emotions. So I'm basically dismantling the blocked bunch of stress one layer at a time until I'm at peace with it. So it's much faster, it's much more logical. And the person that has that trauma is in more control of it. And since everybody in the world, and definitely everybody in an EBT support group, has trauma, we listen to each other. But it's not the drag down way, it's by listening to these cycles. This,
Mhm.
the way we process the emotions, because they all come back to something of forgiveness or joy or a sense of connection.
Mhm.
So this is it's a neuroscientific psychotherapy that you do yourself in small groups, that's affordable, that's scientifically based, and it's been proven to work not only in the short term, but even at 2 and 6 years.
Mhm. I love that. And I just want to go off of kind of what you're just talking about, because it's like when for people who maybe suppress so many emotions and have maybe done that their whole life, have never allowed themselves to process emotions, where do they start with this? Like, is there going to be a longer trajectory for them to get to a circuitry, or is that?
No, not really. What happens is the brain is very safe because the brain won't let you rewire circuits. It's not safe to rewire. It hides them. So we just say be a good consumer of EBT. You're going to come in, you're going to be in your group, you're going to warm up for a few weeks and just try to learn how to use the skills. And then you choose something that's bothering you. I'll give you an example. There's this man who is a doctor and a lawyer, and he was a gay man who was in EBT, and he had had a series of love affairs with men that had really taken advantage of him. But he came in for food. So I said, "What do you want to do?" And he says, "Well, I want to do my food circuit." So he worked on his food circuit and he stopped overeating. And he says, "Really, I want to do my relationship circuit." He's been in now about 2 months by this date. And so he rewired he said, "You do what you're interested in." He wanted love. And so he rewired his tendency to distance. And then he also said he was never authentic. He rewired his role. So he stopped being inauthentic. Well, right now he's on a trip going to, I won't say where, to meet his new partner. They've been conversing over the phone all this time. So what we do is use this method is not about a guru or a religion, or it's about science. And we want to use that science for people's dreams to come true. And all they do is identify something that matters to them that they want to change, and then they change it. And once they've done 2 or 3 of these, they are in love with EBT and they go ahead and complete the rest of the program to raise their set point because they want that security of being cleared of the past, being really present.
Mhm.
And the more they do it, the more it becomes automatic.
Yeah, I love that. And then one more thing too is like a lot of people that listen to my podcast like feel very disconnected from themselves because they've been living most of their life for somebody else. And then they almost don't even know what they want in their life or feel like so disconnected from even their emotional state. How important is awareness before you start with EBT?
Uh, Awareness that they don't feel in joy.
Yeah, awareness of their own emotional state. Like, I know a lot of people who listen feel like I don't even know how I'm feeling. I just feel
Right.
unfulfilled.
No, it's not
Mhm.
necessary because that's what EBT teaches. And
Okay.
also, I really want to support the science here. If
Hmm.
you're a person who doesn't want to feel your feelings, you're pretty darn smart. And the reason is there's so much stress now that the emotions are far more toxic than they've ever been. It's much better. If you don't have EBT, it's much better to just zone out because mindfulness is not going to work when you're that stressed. Positive thinking sounds really ridiculous because you have emotional circuits in your brain. What EBT does is give you a set of tools that are universal, that are easy to use, so that emotions are safe.
Mm.
Because if, let's say that I was pretty numb and I decided I'd feel my feelings. If I don't have EBT, if I start to feel sad, I'm going to get depressed. If I start to get depressed, I'm going to eat or drink. If I eat or drink, I'm going to have health problems. So, because there is a stress pandemic now and everybody needs to have these tools, if you've in the past refrained from feeling too much, it's because you were protecting yourself from being in these stuck toxic emotions that happen to everyone when you're in stress if you don't have EBT.
Thank you for sharing that. 'Cause I think that's just so so helpful for somebody who maybe is listening to this and is just wondering, is this for me? So I appreciate you saying that and just sharing that, like, it's bringing you into a place of safety where you can go into some of those things that maybe your brain is shielding you from in this moment as far as what's going on with society. So I appreciate you sharing all that. And for someone who wanted to learn more about EBT, connect with you, where can they find you?
Well, there's one place to find me. We have a portal for EBT for our whole community, and that is it's emotional brain training, which means EBT, which is the same as food stamps, unfortunately, but it's ebt.org. So you can put in my last name, Laurel or Laurel Mellin, and EBT, but the website's ebt.org. We just launched our new website. We cut our prices in half. So it's only $89 for a full membership with your own private group, the app, the whole program, the forum boards, and daily drop-in sessions. If you like to read the science or are interested in obesity, my latest book is 123 Joy. It's on Amazon. It will tell you everything from the science of the brain to how to use these skills. But mainly just go to ebt.org, sign up. A provider will call you and welcome you. You'll go to your first group and you'll get the app and you just settle in for the first couple of weeks and say, what am I doing anyway? You're going to watch a few videos. By the time you're in for 2 weeks, you will be saying, oh my gosh, I feel so much better. And by the time you're in for 6 weeks, you will have rewired a circuit and the rest is history. You'll be staying with it probably for about a year and raising your set point, because the group, even if you're happy and healthy, going to a group for half an hour a day where you can say anything you want and it's completely confidential and you have support and empathy, it's a great way to live.
Thank you so much for sharing. I'll make sure everything is in the show notes. So for anyone who's listening, definitely check out the show notes, can connect with Dr. Laurel. And I am just so grateful for everything you shared here. And I know that there's going to be something that someone picks up that becomes their next step towards moving forward in their life. So I'm so grateful for you being here.
Well, thank you, Kelly, for all you do. And thanks for inviting me.
Absolutely. And again, for everyone listening, definitely, check out the show notes. And thank you for spending your precious time with us today.
Thank you so much.
Thank you so much for tuning in to this episode of Rewiring Health. I hope you found our conversation both enlightening and empowering. If you enjoyed today's episode, please subscribe to Rewiring Health so that you never miss an update. Also, I would love to hear your thoughts. If you could take a moment to rate and review the show, it would mean the world to me and help others discover the power that we all have within us to create change and create the life that we truly, truly desire. Thank you so much for spending your precious time with me and sharing the energy of the show.